today I'm back with another video blog, and I do want to do sort of a part 2 on long-term care. Last week we talked a little bit about long-term care and some of the good reasons why it's a good choice to start thinking about that when it becomes a safety issue, that your loved one isn't really safe staying at home. Once that decision is made, it's pretty clear you need to start looking for a community that would be a good fit for them. I want to just give you a little bit of an idea of the kinds of services that you might expect from that community. So one of the things is, of course, room and board, and they're both private rooms and companion rooms. And some people really prefer a companion room because maybe that was the person that was really sort of lonely at home and that would really enjoy somebody else sharing their space. You may have a couple. You may be looking to put both parents in a community, and so know that obviously that certainly can happen because they have companion rooms. Another thing you're going to get other than room and board is meals, and they are delicious. At least the communities that I've experienced, the meals are really fabulous. And typically you're going to get 3 meals a day: breakfast, lunch, and dinner, as well as 3 snacks. So in the community I'm most familiar with, the cold breakfast starts at 6:30, which would be cereal and oatmeal, things like that. Then the hot breakfast is at 7, so eggs, bacon, all the trimmings. Then there will be a snack at 10, and they bring those around to the rooms. Then lunch is at noon. Then there's another snack at 2, and then dinner is at 5. And the last snack of the day is at 7. So there's never a shortage of food around. Your loved one is not going to go hungry, that's for sure. The activity director. The activity director is such an important position in these communities because they really are the reason that the elder community that lives there can socialize, interact, experience things that maybe they wouldn't have been able to experience otherwise, meaning they may bring performers into the community to perform for them. They may bring in artists to help them do an art project. They may bring in therapy animals that they can pet. There was a Great Dane that came to the community I'm most familiar with a couple of weeks ago, and he was just a big old teddy bear. So they'll be given opportunities to be entertained when that might not necessarily be something that would have happened if they stayed at home by themselves or were even living with you in your home. You're probably not going to bring a singer into the home to perform for them. Well, they're going to have that kind of entertainment in the community setting. And then from the medical side of things, they can keep their own doctor if they like. That certainly is an option. But the communities also have doctors that come to the community to take care of the residents. So that would alleviate you as a caregiver from having to take them back and forth to their doctor if you chose to use the physicians that come to the community to take care of the residents. And sometimes, very commonly, it may be different in your area, but very commonly there'll be a nurse practitioner that visits weekly, and there'll be an MD doctor that comes and sees your loved one once a quarter. So 4 times a year they would have a visit from an MD. And they also have eye doctors that come, podiatrists that come. And many of the communities, when you start interviewing and kind of looking and touring a lot of them where you are, a lot of them have salons. So the men could get a shave, or the women could get a wash and style right there, as if they were going out to a salon. What else? A lot of them have beautiful gardens, and the residents will actually get involved in planting vegetable gardens or flower gardens, either one. So there's just a lot of really wonderful things that come along with being in a community. Now, pricing. Different communities will have different pricing, so that's certainly an important question for you to ask as you're interviewing and touring the various communities. Typically, a community setting is going to be less expensive than bringing in people into your home to take care of your loved one. And that's often why people wind up going to communities, is they realize they just can't afford to have people come into the home. Now, if you can, you know, and the loved one wants to stay at home and the finances make that doable, then that's fabulous. But long-term care facilities often wind up being quite a bit less expensive than if you have somebody coming into the home to take care of your loved one. So I hope that gives you a little more of a picture of what your loved one might experience if they did go to a long-term care facility. And I just encourage you to tour all the ones in your area because they are oftentimes very different, offering different services and different pricing. So that's important for you to know. And one more point about the pricing. So there are Medicare, if you're 65 or older or disabled, Medicare does not pay for room and board in a long-term care facility. Medicaid, which is a financial need, people apply for Medicaid, they will cover room and board, a small amount for room and board. But if that is a situation that you need a Medicaid bed, just know that not all long-term care facilities offer Medicaid beds. So if that is something that you need, that needs to be the first question out of your mouth is, do you offer Medicaid beds? Because they may, and then again, they may not. There's some facilities in the memory care unit that do offer some Medicaid beds, and there are other communities that their memory care unit, they do not offer Medicaid beds. So those are important questions to ask. So I hope that was helpful. I hope you're having a great week, and I'll be back next week. So have a good one.